Download the all-new Fiji Village app. Get the latest news direct to your mobile. Get the latest sports updates from our scoreboards online. Navigate easily through our categories. Watch videos from Straight Talk interviews, local music videos, sports and many more. You can now easily listen to your favorite radio stations from your phone. Download the all-new Fiji Village app right now.
Welcome to Straight Talk with Vijay Narayan, a special edition as we relaunch with our talkbacks. Very important one. Today, we've got cardiologist Dr. Vijay Kapadia. Dr. Vijay Kapadia, as you may know, had featured on one of our interviews during the COVID-19 pandemic. And one of the biggest issues, of course, that concerns us at the moment is the amount of issues that are coming that are heart-related in our beautiful country, Fiji, and how are we dealing with that? Dr. Vijay Kapadia, who is a true son of Fiji, grew up in Turek, went to Maris Brothers High School, and now resides in Australia, doing some great work there, and then still keeps connected to the people of Fiji and trying to do more for Fiji. So Dr. Kapadia, thank you for taking out time to talk to us on Straight Talk tonight.
It's a pleasure, it's a privilege.
Dr. Kapadia, you were in the country a few days ago with a visiting team. Can you tell our viewers what was that about?
Well, I just got back yesterday afternoon. So I was there for about 9-10 days. And I joined the Pacemaker team that is largely, well, basically a team from New Zealand. And they had already planned to come. And I have been involved with pacemakers too, but the bulk of the work, the majority of the work, the setup of the whole pacemaker service is based on this New Zealand team led by Ms. Fiona Riddell. And there were 3 cardiologists coming. So I thought I would join them. There was some promotional work to do, some coordination to do, and I also wanted to carry on with our angiogram and angioplasty work. So after the team left, I stayed behind and we did some work with our local team. So it was coordination and trying to take things further, because there have been some developments in the pacemaker field, which we all have a vested interest in to see that it goes ahead.
Let's talk in layman's terms now. Yeah. Why pacemaker is so important?
Well, it's a very interesting question and a very good question, Vijay. You have to go backwards a bit or put it in context of what heart diseases are all about, you know. There are many aspects to heart disease. We talk of heart attacks, we need for stenting, we talk of medications, we talk of rheumatic heart disease, and we talk of bypass surgery. So where does pacemaker fit in here? The pacemakers are basically devices, small devices, you know, about a bit over 50 cent, you might call it, in diameter, a bit thicker, that we put under the skin below the clavicle with usually 2 wires to the heart in the right side. It's all done under local anesthetic and sedation. A patient can go home in the evening. It takes on average about an hour. It's more for rhythm disturbances of the heart. And there can be a number of reasons to put a pacemaker. But the most important one is when the heart stops, you see. Often there's a connection between the upper chamber and the lower chamber of the heart, an electrical connection. And often with time and wear and tear, as we all get older, that connection gets lost. That's intermittent and that can become permanent. This condition in particular is called complete heart block. Heart block meaning blocking of the impulses from the upper to the lower. So these people present with blackouts, dizziness, fainting, tiredness, fatigue, and often death. So this particular condition is just one type of patient who needs a pacemaker. I'm highlighting it because it is a very serious one. And in Fiji, we would need about 200 to 300 of these. We have about 200 to 300 patients with this particular condition alone that need pacing. Now here there are no drugs that can make the difference. And a pacemaker, when you look at it, is done under local anesthetic, under sedation, no general anesthetic required. And it's relatively cheap, you know. In Australia, they cost about 4,000 to 5,000 Australian dollars. And that gives you about 10 years of life, you know. It actually gives you life in many of these patients, you see. And when the time comes to, you check the pacemaker at least once a year, check the batteries, and when the battery is running out inside the device, you get the patient in, again, local anesthetic, sedation, remove the battery, reconnect to the old wires, and send the patient home same day. So it's an amazing device, and it's one part of the spectrum of amazing care that heart cardiology can offer. Heart diseases treat some of the worst diseases on earth. More people die from heart disease than any other. And at the same time, that is a challenge. The opportunity is to make a big difference. And in heart care, you can make a huge difference, you know, with pacemakers are one of them. I would say one of the most cost-effective measures in medicine as a whole.
Interesting response, Dr. Kapadia. Now, Fiji, does it have the facilities to start doing pacemaker installations?
Yes. Well, there's a long history too. You see, medical care, cardiac care is very complex, and you don't expect everyone to understand it. Even general practitioners, even people, specialized doctors may not have much of an idea about certain other branches, and cardiology is one of them. The progress, the advances in this particular field have been mind-boggling at times, you know. So I went to, when I was here, I remember seeing patients with these conditions, complete heart block and other rhythm abnormalities of the heart. We sent them home on medication because there was no drug, no pacemaker service. And, you know, it was, you know, well, that's all we could do. But as you went abroad, you learned the intervention required was not massive. It wasn't like rocket science, you know, it could be done in CWM, you know, or other parts of the country too, possibly. So I came back after I finished all my cardiology training. My first visit was in 1986 to start a pacemaker service, 1996, sorry, no, 1997. And of all things, one of my close friends suggested we see our great statesman, the late Ratu Sir Kamisa Semara. So we went to see him to get his support because he had had a pacemaker. But I think it was a difficult time to start a service. It was all a bit premature, you see. So that did not happen. But along the way, Fiona Riddell got involved with Dr. Bakani. Dr. Bakani is probably the father of cardiology in Fiji, an amazing clinician. I had the privilege and the pleasure to be his registrar and work with him later as a colleague, you know. So he also saw the need, but there was nobody here to start the service. So Fiona joined with him. Fiona came here in 2001. And the pacemaker, I must say, the story of pacemakers in Fiji and the Pacific cannot be started without mentioning Fiona Riddell. Her contribution to this service is outstanding, amazing, and there are just no words to describe what she has done for our people in particular. Anyway, 2001, a very basic service was started when the Sydney Adventist Hospital team started coming to do heart surgery, and she joined in because she had had some involvement with through Dr. Bakani. And then that was a great service. But 7, 8 pacemakers were put in when the need has always been over 300 in this country. So you can imagine all these people who, for want of a pacemaker, leave this earth, you know, and for no other reason but the fact that they could have an electrical device put in. So I joined, I was coming with the Sydney Adventist team, and in one of those visits, Fiona and I worked together. I had worked with her in Auckland before, so I know her very well. I know her commitment and I know her professionalism. So after that, she came in with the New Zealand team, Friends of Fiji, and they started doing pacemakers in Lautoka. But then when they realized there's a Cath lab in Suva at CWM, which we set up, the Cath lab is a much more convenient place to do pacemakers compared to an operation theater, as long as we maintain sterility, you see. And what she did was she got pacemaker companies, particularly the Medtronic company, to virtually donate 30, 40 devices a year. So we're getting these devices free of charge through her connections. for her concern for the people of Fiji. See, so when that service started, the doctors from New Zealand started coming to implant. A doctor from America also did a few implants. I did a few. But then the biggest development, I think, has been that we trained our local doctors and nurses and technicians to do this procedure themselves. So while this time there were 3 doctors from abroad, in the New Zealand team, and mind you, one of them who had worked in New Zealand had left for America. He was trained in a Harvard Medical School, University Hospital. He said he would not let this go for anything. So he traveled on his own expenses and airfares and everything from the East Coast of the USA to be with this team. And he spent about almost 14 days with us, you see. And it was an exhilarating experience for all of us. So anyway, our local doctors have now developed the ability to put in pacemakers. So they've left 10 behind. They usually left 10 or 12 behind for those that are not put in. And these devices are then used by our team. What the Fiona also arranged with the Medtronic company to offer pacemakers at a price unheard of anywhere, the lowest price in the world. So they said, well, let's start off with 100 pacemakers for Fiji. And we've been trying to get this approved. And I must say there should be a very bipartisan approach to health. And I'm not into politics and trying to downplay one or the other. And I've just got an email from Dr. Fong, which says that they are trying to do their best to get these 100 devices approved. So that will be a milestone, that we have 2 doctors, technicians, nurses who at CWM have been putting pacemakers for a number of years now. And now we will have this device available to 100 more patients. That's a huge development, huge start, if it does go ahead. And I'm confident that Dr. Fong and Dr. Wang and others will push for this to take place. So that's where we are at the moment. I noted Fiona's statements in the papers, and knowing her, she's been coming here since 2001. She's not one to go into the press, but what she was also frustrated with was that we were not getting anything. We're not hearing anything about these 100 devices.
We'll go to Dr. Fiona's statement shortly, just about the 100 pacemakers. So what is the deal there? The 100 pacemakers have to be...
Well, I cannot disclose the financial side of it. See, Medtronic have been donating 30, 40, 50 devices every year.
Free of charge. Definitely cannot donate all.
They can't. You can't. No company will donate 300 devices. We need more than 300.
So I'm just talking about these 100 pacemakers you're talking about is for the Fijian government to ensure there is funding available to purchase for 100 people.
So. I hope so, because no device, no bypass surgery, stenting, you name it, nothing is as cost effective as a pacemaker. When somebody comes in with complete heart block in the hospital and is symptomatic, you might buy some time with a drip or drug for a while, which can only be given through a drip. But once you take the drug off, that's the end. That's the end, you see. He might stabilize for a while, but that rhythm where the whole thing just stops will occur. And some of them are quite stable. They look well. And those people are not given the pacemaker because we don't have enough. And then they go away. But believe me, many of them will not be alive before 12 months are over.
Thanks for that clarification, Dr. Kapadia. And we'll definitely be talking to Dr. Fong and Dr. Wangaina Bete about it. To get the 100 pacemakers and what's the decision in relation to that.
Yeah, we've been trying to get the service started for a long time, believe me.
How long have we been trying to do this?
Well, as I said, I started in 1996, but I think it was premature then. But we've been pushing for pacemakers. In 2017, I had a deal with the Medtronic company from Australia because I work in Australia, and a very similar arrangement, And we had a meeting with the highest people in government, and I thought something was going to happen. But we can keep asking and we can keep pushing. But nothing much. The powers that be weren't able to go ahead with it. But it's a disappointment as a clinician to see that something that is really quite cheap. When you look at it, when you look at the cost involved, the intervention needed, and the life saved.
No doubt, it's an urgent issue. It's a life and death issue,
Absolutely.
as you said.
Mm.
How urgently can we get this in, and how urgently can we set up this facility to be able to do pacemakers in Fiji
Good question.
every day?
These are not easy decisions. See, we have only 2 doctors in the country who can implant pacemakers, right? Now, they are procedural cardiologists. They may not have the official titles from America or New Zealand, but they function as outstanding cardiologists. Dr. Shaheen Nusser in Suva and Dr. Bharat Bali in Lautoka. I'm totally confident of their work. So they are the only 2 people who can do angiograms, angioplasty, and pacemakers, right? And they do them to a very high level of skill and competence. But when you say that they're going to do 100 pacemakers, they have also got, we have the capacity to run a cath lab in this country 7 days a week, 10, 8, 9 cases a day. And they're the only 2 people who can do angiograms. Just yesterday, I'm sitting here on Monday, they did 4 amazing angioplasty cases, put stents in people. These are people who've come into hospital, chest pain. How much resources they're taking up. And then, some of them may not even make it after admission. And yet the stents have been put in. These are people well deserving of stents. They've gone home and they'll be well, I can assure you. Most of them will do very well. So all this is done by only 2 doctors. So what I would have thought as a cardiac clinician would be train more people, sort out, who would be appropriate and willing to take on. This is an arduous task. It's a mechanical job. You have to put on heavy lead gowns. In a cath lab, you're standing up. A procedure might take 1 hour, but sometimes it might go on for 2. Sometimes the complication occurs or it's more delayed. So one other thing would be to employ doctors from abroad. Employing doctors in our own setting, that's where a public-private partnership, as I see it, has great potential. We may not have all the infrastructure. Our hospitals may not be flashy, and that's not so big an issue as I see it. What can we achieve with what we have? Have clean wards, have sterility maintained. And despite maybe a little bit of rundown on the surface, but can we deliver quality care? And that's what we have done at CWM Hospital. We've created a cardiac unit. We have people who can do echo to a high level. We can do treadmill testing. We can do angiograms, angioplasty, stenting. We have created the background and the foundation of a cardiac surgical unit there.
My question about the cath lab at CWM Hospital.
Yes.
You have been behind getting 3 cath labs for CWM Hospital, all second-hand.
Yeah.
Definitely, we cannot have second-hand equipment when we have the highest rates of heart problems in the country. As a specialist, what's your assessment on that?
Yeah. Well, I think this is a time for me to give up some humility. This whole project was, I saw the need. I saw that, we cannot carry on in Fiji with one of the highest rates of heart disease in the world, death in the world, heart attack deaths in the world, young people with the major adverse, effects on personal life, family, society, and economy. So I thought, okay, we must have a cath lab, and there was not the capacity to run it. So we got one second-hand unit, and we have always been mindful of cost effectiveness, and the health dollar has to be shared by many other subjects, health issues. So we tried to keep it as cost neutral as possible. So we did get a cath lab from Sydney, and it took a while to get it installed. But these are second-hand units, and they will not run forever. So we got another one in 2014. That one I personally secured, but the man behind all the cath labs is Mr. Peter Koons. Without him, this whole project will just collapse tomorrow. And I'll tell you why. He got the 3rd cath lab, which we brought in February, March this year. We don't mind second-hand cath labs. We're doing amazing work on them. But we need support for these units, you see. If the cath lab breaks down, where is the backup? Have we got a service contract, By using these second-hand cath labs, if we're going to deliver the care that you get in a Swiss machine in New York, but your result is the same, I don't think you'll complain about it, So we can continue with these second-hand cath labs. Ideally, of course, I believe there are new cath labs going up in the western side, in Lautoka and Nandi. So if we're able to put in new cath labs there, the place that deserves the newest and the best cath lab in the country is where we've been doing angiograms, angioplasty, and stenting and pacemakers since 2009. We have done almost 5,000 procedures there. We've done so many angioplasties. We've done this last visit, we had 30 pacemakers, you see. So we would like a cath lab to be new, ideally, but if not, we want that service to be supported. For example, when we were doing pacemakers last week, the cath lab broke down 3 times, right? So our pacemaker service would have been finished. We would not have been able to do. We would have to go to theater, and that's very slow, and the number of people who needed the pacemaker would be much less. And who did we have in town? St. Peter. I call him St. Peter. Peter Cones had come for the Rotary function, which we did to commemorate the founding of the Cath Lab, for which the Rotary Club of Suva have been so supportive, and the other Rotary clubs are also coming into it, and we're very grateful for their support. So Peter was in town, his wife was here, and they were on a holiday. So we had to ring Peter, and he came in 3 times, and he was there after we had left. And he said, I'm around in the island, but if you need me, I'll come over. So it's great to have this, but this is not the way tertiary, such a high-powered, highly technical facility should run. We should be able to run a cath lab, with its own arrangements. We don't, if Peter and I, we are both getting on in time and years, and, how long can we carry on with this, So I'd like to, but there must be a system to look after a cath lab. I have put this to the authorities. What happens when this cath lab breaks down? Are you prepared to put in a new one? If Lautoka can get a new one, if Nandi can get 2 new ones, why not the CWM?
How much does a cath lab cost?
It depends. I think things are getting cheaper, with more competition, but I don't think you can get one for cheaper than 2 million Australian dollars, with an appropriate. So at the bare minimum, 1.5 million Australian, a brand new unit.
As far as cath lab is concerned, how important is it as far for cardiac services?
Yeah, it is crucial. It is a nucleus of a cardiac unit. So, when in the past, many agencies and people have said, well, in the developing countries, these things are too expensive. We don't have the technology. We don't have the staff. So we should do our best to, prevent disease, cost-effective measures. Totally agree with that. But when you deny the benefits of modern cardiology, you are punishing a whole community. And Fiji has so much heart disease that you could not just stop at prevention. You needed to go further. And one thing we also need to realize is the amazing potential and capacity of our doctors and nurses. They are very, very well trained, and all they need is upskilling, as everyone does. If you want to train in cardiology in Australia, you don't become a cardiologist on day one. You see, it takes many years to train. So and the other thing, we've trained, most of our training has occurred locally at no cost. How expensive it is to train people. To train a cath lab nurse takes so long, and yet all that training is happening locally. So our model is something, I've been asked to talk in multiple countries how to set up, these advanced cardiac facilities in low resource countries. I don't have any degree in it. It's just the experience we've gained in Fiji that puts us in that space. A cath lab is not everything. I will not say that the cath lab is the beginning and end of cardiology. It must not be. Preventive services, dietary measures, exercise. We have to smoking cessation. We do that properly, and we will reduce coronary disease in the next generation. but still there will be people needing this. And we do so much else in the cath lab. We can open up blocked arteries in the legs to reduce the amputation rate. We can treat rheumatic heart disease. We put in pacemakers. We then decide who needs a bypass operation. You see, it's the roadmap that you carry out with the angiogram that, it's a major facility, but the procedure is generally, safe. Complications can occur. Takes about 20-30 minutes for basic angiogram, longer for if a stenting procedure is required. And so it gives you a lot of options. And it's a facility that I think every country must have, and Fiji definitely needs one.
We're turning 52 this year, Fiji Day, October 10th. 52 years of us being independent. The question is, how important is it for us to have a cardiac facility in Suba City, in CWM hospital, that can provide for the people, apart from other facilities that we can have out of Suba?
Well, I think, it's a good milestone. And we just wish that, Fiji progresses in every way possible. It's not just Suva City, I would say, Vijay. The thing is, we need an overall planning for healthcare, definitely, and for cardiac care, So how can we, I think Fiji needs more than one procedural facility. I'm pretty sure that Lautoka needs one. And whatever is happening in Lautoka should be, able to look after that region. But it should be part of a comprehensive whole. Compartmentalizing one system, being different from another, I have concerns. So we have a national cardiovascular service which looks at prevention, which looks at how we treat our heart attacks. We bypass surgery and all that, angioplasty stenting is great, but how are we treating our heart attacks? These people have heart attacks, right? Coronary artery disease. We have some of the highest heart attack rates in the world. So there are drugs to dissolve blood clots that cause the heart attacks. These are the people that need stenting too. Ideally, they should come to a cath lab in an emergency, but that's difficult, and in many countries or many communities, it's not possible. So they get these drugs to open up the artery, and later on they can have an angiogram, angioplasty to unblock whatever is remaining. See, so I think a national approach to heart disease, prevention, smoking cessation, exercise, all that is a foundation, and then how to offer these procedural facilities, procedural investigation, procedural treatment, which occurs in a cath lab, and then surgery. Surgery, by the way, is something that we have all wanted, but surgery comes on the top of a cardiac service, a cardiology unit, So it's important to have all that before we talk about cardiac surgery. And cardiac surgery takes a while to start. So I would not go around. I wouldn't be, critical that it's not happening. What's happening in the field of cardiology is more important. See, how are we treating our heart attacks? What's happening to our pacemakers? And cardiac surgery in a large number of patients is not prognostic, nor is stenting. Stenting in people who are having acute symptoms, yes, very helpful. Heart attack, yes, but otherwise they don't prolong life. It is very helpful in a small number. In Fiji, a larger number, where cardiac surgery can make a huge difference. But in many patients, it is something that improves symptoms.
Now, Dr. Kapadia, you have been at CWM Hospital. We'll talk about Dr. Fiona Riddell. She's, of course, from Pacific Pacemaker Association, and you did a lot of work with her over the years. She's made a strong statement that since she's been coming to Fiji for the last 2 decades or so, she hasn't seen the infrastructure upgrade at CWM Hospital and Lautoka. She was concerned about it, about the lack of development of infrastructure. You have been trying to do things in Fiji with our health facilities. What's your assessment?
Well, first of all, as I said earlier, Fiona has been a very important part of health, cardiac care in the Pacific, particularly in Fiji, and her contribution has been amazing. And yet she's never been in the press. People don't know who she is. It's only us who are in the field know her, and I know her particularly because of my time in Auckland working with her. But you see, she also does a follow-up. Pacemakers are just one thing to put in, but every patient who has a pacemaker needs follow-up. So she has the entire list of patients who need cardiac follow-up after a pacemaker. This is a very important part of a pacemaker arrangement. And every year she's been doing that for all these years. Can you imagine? She brings all the patients to Lautoka, all the patients to Suva. She comes on her own and she does all the checking, right? So she was very, very keen that we have a local pacemaker service, not just the 3040. If memory serves me right, she was the one who negotiated with Medtronic, or at least asked them to come up with this new deal, which is really very, very, outstanding. So here is a concern for Fiji. You see, she doesn't have to talk to Medtronic or come here or do anything for the country. And why she got the New Zealand Order of Merit, for her contribution to medicine in New Zealand and also for the Pacific and particularly Fiji. So I think there must have been a bit of frustration in her because we were not getting a response about these 100 devices. We were there, the team was there, no one had come to visit them, talk to them. The actual people who made the proposal were in Fiji. So it's only today that I see the email from Dr. Fong that this is likely to go ahead. So when that was not happening, here we were again, and we're going to put 30, 40 pacemakers, leave 10 behind. But what about the other people, you see? And we were also concerned that some people whose pacemaker batteries were running out were, probably not contacted or did not have a device to have put in. So it's very sad that when your pacemaker battery runs out, that's the end of life for you. So if this had happened, and we can't be 100% sure, but in the system, we feel very concerned that, and it is depressing. So I think she was, and I don't know exactly what she said and whether she was misquoted. She's talking more, in my opinion, of the need to bring up these facilities so that we can put in pacemakers. We were quite happy with what we were doing at the CWM Cath Lab. It's not the best Cath Lab, and you'd want a better Cath Lab, but we were able to do 32 pacemakers there in that facility. So I think what she said should be taken in the overall context and infrastructure. When you work in Australia and New Zealand, you're used to very amazing, hospitals and things, So that's not the same here. And truly, our infrastructure has not probably kept up to the level that it should have. And, I think finance and other issues come into what can we deliver. I think infrastructure development is important, but what is far more important is to develop local capacity and have a coordinated, comprehensive approach to cardiac care, where experts in the field, local and external, people like myself, who's I'm very happy to provide ideas about planning for the future. My colleagues who have come from Australia and New Zealand, some of the who's who of local cardiology, world cardiology, some of them, they would be very happy to join in as part of a forum, as part of a discussion to guide this country into what cardiac care should be all about. This is advice that is, you can't pay to get this advice. And these are people, I don't want to quote names, they're professors in their departments, heads of departments, in New Zealand, in Australia. My boss from Canada, who came, was one of the pioneers in the field, he even left a statement behind, of how to take things further. So I think we need to get down and plan, because this is a big, big issue. It cannot be done in half a day by one person. And Professor Seals from the American College of Cardiology had said, this is not for one man, one country, one hospital, one institution. It's a global exercise and a global cooperation.
I'll ask you the question. You being the specialist, you being from Fiji, going and coming back, looking at the needs, knowing what CWM needs.
Yes.
I had that conversation with you earlier in the year when the last Cath Lab was coming. Which was installed, the second-hand one. Some families were being turned away and told by people, their loved ones were lying on the bed before the cath lab came in. They had no option but to go. If they needed to go, they needed to go to the private facility, which was charging about $20,000 at the time, a few months ago.
Yes.
Now, this
Yes.
is what we face with. And if they don't get that, then basically they lose their life at that point in time, at
Yes.
some point in time. Now,
Yes.
based on life in that situation, we've talked about
Yes.
pacemakers, we've talked about cath lab. I will talk about financing these type of projects
Yes.
that are critical, a life and
Yes.
death, critical
Yes.
components.
Mhm.
From your point of view, where should the money be going as far as cardiac is concerned in Fiji?
Yeah, it's a difficult question because finance is needed for so much else, for infrastructure, for education, for other things, cancer medicine, So, this is where a whole team approach with multiple, stakeholders are needed to see. We can't provide everybody with the best healthcare possible. It's not possible even in highly developed, rich Western countries, So in Fiji, by the way, not everybody who needs a stent will die without one. You see? And the pacemaker too, there are many indications for pacemakers which are very, very necessary. But there are certain types, particularly the ones that come in with complete heart block, who come into hospital with 20-second pauses. These things keep happening, they won't live. So yes, there are a lot of people who need stenting who will not survive without a stent, but not everybody. A lot of people who need bypass surgery will not survive without bypass surgery. But here the number is even slightly less, but they will definitely have a much better quality of life, So with the stents, and it is needed, it's definitely needed. Both these things are needed. So I think a whole of country approach, with and training our local people. We need to train we need more people in the field. See, we have 4 times the heart disease incidence of Australia. So for almost, say, 900,000 people, if we're looking at heart disease, it's not the most accurate, connection, but at least a 2 million, a city of 2 million people, or even the Gold Coast, where I am, about 600,000, we have about 6, 7, 8, 6 heart surgeons. We have, I don't know how many cath labs. We have about 40 cardiologists. It's overdone here. But, we need far more than the 2 we have. We need more doctors. We need a proper cardiac facility at the CWM. Whatever else you are doing in the country, that's fine. But no place needs a full cardiac facility more than CWM. It's for the country. It's not just for Suva. You see, this is where the whole history of medicine has been. The whole nucleus of medical care has been at CWM. That's where we have developed a cardiac service. And the next step is a cardiac surgical unit. So a cardiac surgery, and we've done heart surgery at CWM for 30 years. Visiting teams have come there regularly. And in 2014, when the new upgraded facilities were opened, the theaters were made suitable, particularly for cardiac surgery, you see. So we have the capacity. I think we need space. It's not, ideally, if all these foreign governments came together and for their aid to the Pacific, we created a South Pacific regional tertiary center to which they also contributed with doctors, nurses, training, attachments, exchange programs. We could have a massive, very good general hospital starting new, because in CWM we're adding things, but adding things appropriately, correctly, cost effectively can still take us a long way. So finance, yes, I think we should. And with cardiac disease, we can do so much. Life is lost. People are young. So I think a preferential approach to cardiology to some extent would be, in my opinion, appropriate. And, some extra funding there would be very, very helpful.
Question about, there's been comments, statements that have been made about heart surgeries to be done in Lautoka. They haven't started as yet. Some dates have been set and postponed to later dates. What's your assessment of that? Definitely, you've been watching that closely as well.
Yeah, I've been watching because we watch a lot of things about Fiji and healthcare in particular. I haven't been to Lautoka for a long time, and I don't exactly know what I've heard from people who are there, but I don't know exactly the developments there. Again, it's heart surgery. We're talking about heart surgery, and as I said, heart surgery is very important for Fiji, and we need a heart surgical unit. But when we talk of heart surgery, it's not available, it's not here, it's not there. It almost makes you feel that everything else is perfect. The pacemaker service, as I told you, our heart attacks, how are they being treated? People go to health centers with a heart attack, they should be able to be treated there. But the drug that we have, while it's a good drug, it's not something a health center nurse is confident enough to give. The more expensive drug will be something that a health center nurse and ambulance officer can give. It's expensive, but then all the savings that occur after that, possibly no need for an angiogram, or may not need a bypass operation, all that. So you save a lot that way. So what is our policy overall in the management of heart diseases? So talking about bypass surgery is, I think, and bypass surgery, a heart surgical unit takes a long time to develop. So if there are delays, I can totally understand that. But at the same time, you must see that a heart surgery unit is based. What is it based on?
Now, in all of this, medical expert advice is absolutely critical when you're going into. Fiji has got one of the highest rates of heart disease, heart attacks. You're saying, very concerning. And if you match it with the facilities we have very little. And based on that, medical expert advice, consultation, a lot more talking is needed. Is that happening at this stage?
Well, I don't think it's happening to the extent that it is. We don't have that expertise in Fiji or anywhere. As Professor Seals has said, we have to fight cardiovascular diseases. I'm just reading. #1 cause of death globally. Fight cardiovascular diseases globally. International cooperation is required. Global collaboration is needed. It's a global epidemic. Should not and cannot be tackled by one individual, hospital, healthcare provider, or country in isolation. So we have to cooperate, And this is the president of the American College of Cardiology telling its American College of Cardiology, international outreach, and the global cardiovascular community, right? So to get together, to take advice, there's nothing wrong in that. So whatever happens in Fiji, I hope that all the developments that are taking place, bring in medical cardiac input, because without that, we may not be getting all the right solutions. What we may be doing may not be appropriate. It may be appropriate, and we may have had all the right advice. I don't know what advice goes on. But here we are. We are received very well, in a very friendly manner. We appreciate that. But when it comes down to our requests to sit down, talk, let's plan for the future, that unfortunately has not happened. And I'm willing. I may not be the most knowledgeable, but there wouldn't be too many people. And I'm also local. I know the local scene. I worked at the CWM for 6-7 years. I keep coming there. We and all these people who come, why should that doctor come from the east coast of America, right, to pay his own fares? We have no financial support too, by the way. And it's all these people who come and do all this work. It would be nice if the airfares and accommodation could be provided, because they've been doing this. Fiona has been coming in for 21 years, So the type of work they do, some support would be nice. See, the Cath lab does bring in some finance, There were some fee structures, We would like to access that so we can at least look after some of our needs, there.
My final question, Dr. Kapadia, definitely this will not be the last interview that we do, because this is now a moving issue, a moving story, and affects a lot of Fijians at this stage in relation to how cardiac facilities are to be run and how people are to be cared for, the different options available, the equipment needed, and what is government's commitment and what is the whole of country approach as far as this issue is concerned. Definitely you have been trying to have that discussion. Now you're saying the next step is this 100 pacemakers. What's the next step that is expected for you? And on top of that, just your visiting teams also, they have to take care of all the costs apart from doing the service, providing the service for free,
Yes.
providing for their own accommodation and airfares, etc. How long can this go for? What is your assessment coming to now?
Yeah, I think, see, I been coming for years, 1994, my first visit, 96, 97, many times, and I don't want to boast about all that, but I was asked to give a keynote address at the annual GP conference in 2007, cardiovascular diseases in Fiji, challenges and opportunities, and the opportunities in this country are amazing. What can be done, and it's particularly because of our people, the people who we have here, who can take this country forward. I am not here at the moment. I'm not in Fiji, and there's so much work that is going on. These people are putting pacemakers, this, that. Bypass surgery can also start later by our own surgeon. That takes a much longer training process, but that too can happen. And in every other field, we're seeing great developments in pediatric cardiology. So at every level, we can take things further. I feel we should sit down. We should have a big Talanoa session, and all the stakeholders, get the community, get business. We can't do this all by government money. Business contributes to healthcare all over the world, So when the Rotary Club comes in, like Good Samaritans, we are very, very grateful for that, But at the same time, perhaps we could involve business leaders, into a discussion. How much funding can we receive from business, because after all, it's anybody can need a pacemaker. When you need a pacemaker, sometimes you can't leave the country, You might need a full medical, jet to take you away, but you can't just sit on a plane and go. So a lot of things can be done, but we will not be able to offer a perfect solution. That a perfection is very difficult in healthcare, and this has to be a bipartisan approach. I speak because of my concern for the country. I have met people at various levels in different capacities, and I think we see good intentions everywhere. No one wants bad intentions for the country, but it's a time to sit down and talk with all the stakeholders, and medical input, very important. Appropriate medical input, plus other people, nurses, technicians, business, community leaders, and how we can take this forward. It's not going to happen in a day. It'll take a long time, but at least, we start off correctly. Some things are already in place. We need to improve. Some things are needed. I don't have all the answers, and I don't think anybody has, but at least we sit down to plan ahead,
It's a very concerned cardiologist from Gold Coast, true son of Fiji, born and raised here, and continues to give back to the country, just leaving the country yesterday after doing some successful pacemaker installations, Dr. Vijay Kapadia. Dr. Kapadia, as I said, this will not be the last interview. We have work to do to go back to the ministry and ask what is the plan going forward, and also come back to other stakeholders on a whole of country approach on this very critical issue as far as the health sector is concerned, and what our country will be doing in relation to this. Thank you very much for your time.
Thank you very much. Thank you.
Download the all-new Fiji Village app. Get the latest news direct to your mobile. Get the latest sports updates from our scoreboards online. Navigate easily through our categories. Watch videos from Straight Talk interviews, local music videos, sports, and many more. You can now easily listen to your favorite radio stations from your phone. Download the all-new Fiji Village app right now.